who should not do a ketogenic diet. My name is Dr. Ruth Dunn. I'm a board certified adult psychiatrist, and I look at the overlap between mental health and metabolic health. And a ketogenic diet is one of our most powerful interventions to help with mental health symptoms. However, that being said, there are cases in which a ketogenic diet is contraindicated. There are also cases where it's not necessarily contraindicated, but there can be some challenges associated with that, and I'll do that in another video. But let's talk about the contraindications. So the first one is going to be if you have a rare inherited metabolic disorder. So this is usually something related to your mitochondria, your lysosomes, peroxidase, some sort of enzyme related disorder, and you'd probably know if you have this. Second is going to be if you have some acute medical issue going on, like you have acute heart failure or pancreatitis or kidney failure. These are not times when it would be safe to embark on a ketogenic diet. And then another one is if you are taking an SGLT2 inhibitor, which is a diabetes medication. It ends in gliflozins. If you're taking this medication and you're on a ketogenic diet, then you're at increased risk of ketoacidosis, which is a very dangerous condition. And then the last one is going to be if you're pregnant. So when someone's pregnant, they're in a growth state, meaning a higher insulin state. And this is basically the opposite of what you need on a ketogenic diet. Now, while some people who've been on a ketogenic diet for a long time, have been eating low carb for a long time, may be able to safely do this. If this is something that you're considering starting for the first time, during pregnancy is not the time to do it. And even if you do fall into that other category, it's definitely something that you would need the support of a medical provider to make sure that you and baby are doing well. So these are the absolute contraindications to a ketogenic diet. If you have any questions about this, feel free to put in the comments below. And like I said, we'll talk about some of those other situations in a future video. Wishing you all good mental health today, and I'll see you in the next one.